Hi, welcome to Naptime Nutrition. I'm Yaffi Lvova, registered dietitian, and today we have the special pleasure of having Rapoport, LMFT, with us to talk about postpartum depression. And did I get all your alphabet soup right?
Yeah, excellent.
Thank you. So I've covered postpartum depression before, and I just want to bring up this infographic that I had presented, and I'm going to make a link to that as well. And if anyone's interested in the printable PDF of this, please just message me. I'm happy to send it everywhere and anywhere. This is nutritional management of postpartum depression, but today's session is going to focus on the therapy side of things and the mental, emotional, social side of things. So taken together, both Naptime Nutritions are going to give you a lot of information. And today, we're just going to talk about what postpartum depression is, how it manifests, how you recognize it. So, okay, so let's start off with what is postpartum depression?
Well, what a great question. Postpartum depression, I think, is one of those things that really has gotten a lot of press, not all of it accurate. And so postpartum depression is really an occurrence of what we would call major depressive disorder, but it's specific to somebody who has just given birth within the last year. So we would be able to diagnose it in somebody who's had a child in the last 12 months and is having symptoms as sort of a consequence of that. So what those symptoms can look like with any sort of depressive episode, can differ from person to person, but there's a bunch that are sort of in common and that encompass the whole diagnosis. So they do include some things that we sort of really think of as pretty typical to depression, things like crying, being really sensitive, having a really difficult time kind of managing your emotions. But it also includes a lot of things that are more like withdrawal, things that have to do with changes to appetite. If people are sort of finding that they are eating a lot more than usual, or that their appetite has really decreased pretty significantly. Changes to sleep. So again, people who are really finding a huge need for sleep, or are finding that it's really impossible for sleep. You'll notice a lot of these things sound a lot like just regular parenthood.
Yeah, I was thinking that.
So in some of these things, really the thing that we look for to determine whether you have a case of the parenthoods or whether what you have is something that really falls into the category of depression or that you should look out for is the severity of some of these things. So right, we want to look at not only are there changes to your appetite, because of course there will be, if you're breastfeeding, certainly there will be some changes, but rather, is it happening to an extent that is really, really represents a very big change from something that happened before, right? The same thing with sleep. Are you finding that you're having a difficult time sleeping because your baby's having a hard time sleeping, or even when the baby sleeps, it's impossible for you to sleep? Or even if all of those things are going well, you're still exhibiting some of these issues. Right. Another one that we really look at is a decreased interest in activities that you used to enjoy, and not necessarily out of just not having enough time to do these things anymore. But really you find that you're just not interested. You don't really care. You don't feel drawn to them anymore in a way that you used to before. It can also look like irritability or anger. And I think that's one of the ones that tends to fly under the radar a lot, because depression really, so many people associate only with sadness, with crying, with moodiness like that. But it can also just be really having such a low threshold or very little patience for anything, because you're sort of so depleted in terms of emotional capability. It can have really an impact on concentration, motivation. So there are a lot of those factors that are affected as well. And one of the other sort of components that's more specific to postpartum depression than it is to what we would call major depression and without a postpartum onset is the anxiety that goes along with it. So for a lot of mothers who experience postpartum depression, there's also a really big component of worry, fear, angst. Am I doing this right? Not just in a, I'm not sure, maybe it looks a little funny, but but really in a like, am I doing this in a way that is going to hurt my child? Is there something that I should be doing better about this? And sometimes it really expands to everything, just a worry about, as many things as you can come up with. Why is my partner not home? What is happening here? What is that? And so I think that's one of the things that looks like too. Another really big thing to kind of keep an eye on is that there are a lot of ways in which postpartum depression really differs from what is sort of most publicized, which is postpartum psychosis. And postpartum psychosis happens in a very, very small percentage of people. And those are the people for whom the depression is so, so, so severe that it really starts to border into what we would call psychosis. So there are some delusions. There's maybe some difficulty determining what's real and what isn't. Those are the times where people start to have urges to hurt themselves or to hurt their children. But postpartum depression really looks quite different than that and is never, that exaggerated.
And it could look different for different people. Unfortunately, those are the stories that make the news. So someone who's experiencing a more midline of the spectrum depression might think, well, I don't have anything wrong with me because I'm not thinking of harming myself or my child. When truthfully, there is help. That just because you're not experiencing those drastic symptoms, that there actually is help for you as well.
Absolutely. And so that's one of the ways where we sort of talk about differentiating between kind of the baby blues and postpartum depression and how those things are similar, because there are many people who have some of these things and it really doesn't develop into something bigger or into something kind of more significant. And so one of the things we look at is duration. So thank you.
So I'm gonna put this picture up that you sent me, and we can just talk about that. So that's taking the whole screen. So let's talk about the difference between baby blues, postpartum depression, and postpartum psychosis.
So it's really estimated that anywhere between 50 and 85% of women will experience what we call the baby blues. And so this does include some of the things that we talked about before, like sadness, irritability, crying, really feeling overwhelmed, problems with sleep and appetite, mood swings, but those usually resolve within 2 weeks. So it's really very normal for people to experience those for the first couple of weeks. But if it's starting to go past that, or if it's starting to feel a little bit more severe, that's really when we sort of are looking more at postpartum depressions. And so those can begin right away. So it can have the same onset as kind of the baby blues, or they can take months and months and months to develop. So as long as it happens in the first year postpartum, it would still be considered sort of related to the pregnancy. And some of the symptoms that we talked about earlier that are here obviously are about depressed mood, having not just mood swings, but pretty severe. So really feeling like everything is okay one second, and then the next moment you're sort of so overwhelmed that it's really difficult not to cry. A lot of irritability, anger. And again, a lot of these things are going to be over pretty nonsense things, right? Like, or what we would not consider necessarily as really, really dire. That some of the moodiness or some of the sadness or the teariness can come up over things that sort of feel like, I once had somebody tell me I walked into my closet and just burst into tears. I couldn't tell you why. There was no greater problem. It just was, I thought my red shirt was in there and it wasn't. And that just felt like a lot in that moment. One of the symptoms too that happens sometimes, but not always, in postpartum depression is a difficult time bonding with a baby. So there's a lot of that happens where I think moms are really told that, pregnancy and new motherhood is magical and amazing, and you will feel nothing but bliss. And a lot of women truthfully don't experience that, certainly not right away, especially when compounded with difficulty sleeping, changes in appetite, things like that. And then the last couple of things you'll notice on there is a lot of the guilt or the feelings of inadequacy, really feeling like, you may be are not cut out for this, and really kind of doubting your abilities in that way. So again, the more sort of extreme version is, thoughts of harming yourself or other people. But for the majority of people, that's not what it entails. And the good news, I think, as you mentioned, is that it's so highly, highly treatable.
So speaking of treatment, a lot of people might avoid getting treatment because they associate treatment for depression with pills. Is
Right.
there any other way to treat it that doesn't involve pharmaceuticals?
Absolutely. So there are a couple of options in that respect that are really helpful. One is support groups. So women who are able to talk to other women who are going through some of the same things and really feel like there's a place to go to share where there's no judgment, there really isn't anybody else's kind of critical thoughts around that, has been found to be incredibly helpful. Another option, which is where I come in the sequence most of the time for people, is psychotherapy. And so traditional talk therapy can be really helpful because it gives people an opportunity to really, again, be able to share all of their thoughts and their fears and their worries in a place that's contained, where there's no judgment, and where they really feel like it's okay to talk some of those things through. And so oftentimes with those things alone, we're really able to help people make enough of a difference in terms of their mood and their functioning that they don't necessarily need to look into medication.
So it's not to knock medication. It definitely has a place. There are just also ways to cope with it that don't have to do with medication. And I covered that I covered the nutritional aspect in the other nap time nutrition that I spoke about. But what I actually found out in between doing that segment and doing this segment is that there's also a postpartum depletion that's more long lasting. And so when you're talking about postpartum depression being within the first year, sometimes you have women who are 2 years, 3 years, 6 years out. And there was a study published that showed that depression among mothers is most common when their child is 6 years old. So that's not postpartum depression, but it could be related to the pregnancy biologically, because pregnancy is very difficult on the body and breastfeeding is very difficult on the body. And should you get to a place where you're not taking care of yourself nutritionally, or you become depleted and haven't had an opportunity or haven't been guided appropriately toward repletion of those important nutrients that you're missing, that can manifest as depression. And so therapy can also help you work through that, because at that point there's going to be the physical as well as the mental. But it's important to know where your depression comes from and to have a full physical workup to make sure that you're on target biologically while you're working on the mental and social aspects of this time in your life.
Yeah, absolutely. I think, one of the things that I think hopefully most good therapists would recommend is a really thorough physical, because there are a lot of medical conditions or sort of biological situations that can mimic psychological disorders. And so I sort of frequently say to people, I don't want to spend a year treating you for panic disorder if what you have is a heart condition, right? So we really want to sure that people's physical needs are being addressed and really being taken care of alongside the sort of psychological and emotional component. So absolutely.
Yeah, often in society today, we value the physical health above any mental or social health. And it's a full package. When we're talking about comprehensive health, we can't prioritize any one type of health over another. Because if you're in perfect physical health, but you're suffering mentally, that it needs to be addressed as well. And the same in reverse, if you're perfectly fine, well, I'm not sure that it would be common to be very fine mentally if you're not fine physically. So it's really good to keep everything in mind and to have a good, adequate healthcare team full of experienced and credentialed, educated professionals who can help you be the best person that you can, because that's what your family deserves. That's what you deserve. So we also have another picture, how to cope with PPD. And I'm going to make that the only one. Okay, so let's talk about how to cope with it. So you have discovered you had a child fairly recently, and you're having these overwhelmed symptoms, questioning yourself, all these things that you talked about, Sol. So what do you do from there?
So I think really identifying some of these things is the first step, right? And really recognizing that you're maybe having a hard time dealing with them. So talking about seeking help for that, we sort of talked about how support groups can really be valuable in that respect. And also, if you feel like you're ready to look for a therapist or some counseling, there are a number of really good ways to do that. Obviously, if you have insurance, you can go through your insurance companies. One of the things I always tell people is that when you look for therapists, it's usually really helpful to find people who have a significant amount of experience with postpartum depression. So it's not something that everybody specializes in. And I think it's one of the areas in which it really is helpful to meet with someone who is well versed in the situation and the symptoms and what are the sort of specific interventions that are helpful. So you can look on Psychology Today, you can look on your insurance's website, for example, of providers. And it's always good to try to filter by either people that specialize in women's issues or in postpartum depression, or who maybe don't necessarily specialize in that, but have a good amount of experience in that area. Somebody who is treating some other disorders may not necessarily have the same amount of information at their disposal. And another way to sort of ask for help isn't just professionally, but at home in your own support system, right? I think a lot of people are incredibly well-meaning and say things like, let me know if you need any help, reach out if you need anything. And there are these really kind of vague, open-ended things. But the truth is that if you are struggling with postpartum depression, if somebody says, let me know, it kind of puts the onus on you in a lot of ways, right? To sort of have to come up with what to do and how and in what ways. So even letting people know around you, hey, if you offer really specific things, like I'm going to come hold the baby for an hour, I'm going to bring you a meal, I'm going to do something really specific and concrete that's going to be helpful, let them know that that's a really a much more helpful way to sort of offer support.
And that's something that we can take for when someone we know has a child, that we can take that advice and say and offer specifics. And
right.
What I like to say is, when you have a baby, you get really overwhelmed. I'm just demonstrating that by stuttering, and I'm kind of overwhelmed myself at the moment. Anyway. Meal planning is a really great way to get something off your plate. And yes, I did intend the pun. And so when someone offers to come over, it can be uncomfortable to ask them to clean your toilet or to to do a lot of things, or take out the trash. Sometimes you don't want to ask someone to do that, but you can ask them to chop some vegetables for you. You can ask them to bring you a meal or pick you up something at the supermarket. Those are things that are going to make your life so much easier. Having food that you can just open your fridge and grab something is going to make such a difference in your feeling of overwhelm. So if you are looking for something, if someone does offer one of those vague offers, you can ask directly for that, and nobody's going to mind chopping vegetables for you. It's pretty, it's pretty benign as far as actions go. Yeah. So how can you recognize it in yourself and others? We talked about some of the symptoms, but I know for myself, I had postpartum depression after my first pregnancy, and I would say things like, there's a boulder on my chest. And I was saying that to people who I didn't know what that meant. And I wish that someone had told me. And so if you hear someone saying things like that, if they're expressing constant and stifling anxiety that's getting in the way of their life, what are some other things that people might say or might do to clue you into the fact that they're suffering?
I think that's such a great example, sort of defining it so concretely, or sort of talking about this boulder. A lot of people really talk about the heaviness, right? And really feeling like, I feel like it's just so hard to to move sometimes, not just literally, but right, like to walk through all of the things that I need to do. It just feels like there's always something else there, and I have no idea how to put this down. So to kind of continue the sort of boulder analogy, right? People a lot of times talk about, I don't know how to put this down, right? People tell me that, you know, I should just stop feeling this way, and I can't. I don't know how to talk myself out of it. I don't find, people tend to sort of say what they think are really helpful things, like, you have a beautiful baby, what is there to be sad about, right? Or, you know,
Right. It just adds to the guilt. It just compounds your terrible feelings.
exactly. And so now, on top of the fact that you feel bad, you feel guilty about feeling bad because apparently other people don't feel bad and you shouldn't. And so it's kind of this layer upon layer upon layer. And so I think when people say things like, I don't know what to do with this, right? When people say, I've had a couple of people tell me that they said to people around them things like, I'm just not sure I was cut out to be a mother. And nobody said to them, why? What makes you feel that way, right? What are some of those things? So if you notice somebody who's sort of talking about really struggling, I think that's an important thing to look out for. The other thing I really talk to people a lot about is asking people who've just had a baby open-ended questions. How are things going? Tell me, what's motherhood like for you? Is it what you thought it would be? Does it look different than what you thought it would be? Because that gives people who are having a really hard time the opportunity to talk about things in a different way that isn't just like, it's amazing, isn't it? Right? Isn't it all wonderful? What's your favorite part? That I think has put so much pressure on people sometimes. So when you ask these open-ended questions, like, tell me about what it's been like for you, a lot of times it gives people this opportunity to sort of talk about some of the real parts that have been difficult that they've been maybe more reluctant to say out loud.
Yeah, yeah. I'll never forget the time when my twins were about 6 weeks old, and I was in Bye Bye Baby or Babies R Us or something, and I saw another woman with a child about the same age, and it turns out that that was a twin, and the other twin was home with a nanny or I don't know. And she just said to me, "Isn't this hell?" And I laughed and said, "Yes, yes, I'm in hell." And it was so like, it would probably sound to the outside world.
Yeah.
What?
Thank goodness for that woman's honesty.
It was amazingly validating.
Yeah.
And it was just refreshing to be able to say what was actually on my mind, because you fake it so much, and sometimes, you know, sometimes it's okay, not everyone has to know what's going on with you, but you should pick a few people, and really they should know what's going on with you. They should know what's in your head and what's in your experience. And when that random woman just related to me on such a deep level with such a quick quip, I mean, that was like, yeah,
I
it
think
changed my perspective.
I'm so glad you had that experience and that woman was able to be so sort of direct in that way. You know, it's funny.
Yeah.
I think this is such a an important part of talking to other people when you think that they might be struggling, because that can be really challenging too, right? How do you approach someone and say, you know, I think you might have postpartum depression, especially because there is so much stigma around it, and because I think part of struggling with depression revolves around necessarily feeling kind of incompetent or like you're failing in some way. So if somebody calls out and says to you, I think you have this, it can be really difficult for people not to sort of internalize that, like, wow, it's apparent that I am failing. Everybody else is noticing too, right? So
that's painful.
It can be really tricky to talk to people about that. And so I think one of the things I really recommend is talking to people about symptoms, not about the person. So not like, you look like you're struggling, but, you know, I noticed that you really haven't been sleeping very much. Let's talk about, you know, how is your sleep? Or rather than saying like, wow, you look just sad all the time, what's happening? Or, you know, you seem really anxious, talking to people and saying like, you know, it seems like you might be worried about some things. You know, can you tell me what kind of things you worry about? So talking about sort of the symptoms as opposed to the person as a whole can be one of the things that really helps people to see it as an illness that they have, as opposed to who they are and how they individually are struggling. And I think the other really big part of approaching somebody that ties into your story so well about this woman at Babies R Us was how incredibly powerful sharing your own experience can be, and how normalizing and validating it can be to say to somebody, I remember that time, I remember those weeks, I remember those months, they were rough. They were rough, and really kind of giving somebody the opportunity to be able to say those things and knowing that you are going to be somebody safe to talk to, that they won't be judged by you, that they're not going to be critiqued by you, but that you're really going to provide compassion and understanding is huge. And it makes them much more likely to listen to any concerns that you might have.
Right. It makes so much sense. And I think that it's amazing how in our society we praise the woman who gets pregnant, and then there's the baby, and everything shifts off of that woman, and all of a sudden all the attention is on the baby, and no one asks the mother, how are you doing? Yeah. And how, and like you brought up the sleep, you should ask open-ended questions about her sleep, and don't ask how is baby sleeping, because babies don't sleep, okay?
Right.
There's going to be that random unicorn baby who sleeps at like 6 weeks, whatever. It's not normal. So asking how the baby's sleeping right after the baby came home from the hospital is really not helpful to anybody, depression or not, really.
Yeah, I think that's a really good point, that there is such a shift, and it's so immediate and it's so dramatic in terms of, you know, everything that comes afterwards, in terms of all of the gifts that come or for the baby, all of the attention, all of everything is on the baby. And obviously some of that is wonderful and should be, but not to the extent where it really kind of negates the person who brought the baby to the world, and who is also doing a fair amount of recovering physically, emotionally, psychologically, in any number of ways. And I'm sure you've sort of talked about the hormonal piece as well, and all of those. But there was just a trauma that occurred to your body, an actual trauma that just occurred to your body, and so you are very much in a recovery period. And I think really, again, kind of having this validation of a woman's experience in that way and checking in with her, I think is so key. So yeah, you're absolutely.
So I'm going to throw something out there, and you can tell me what you think. I have come up with a non-threatening way when you see someone who you think is suffering. I think it's good to bring attention to it without making them feel guilty. And so what I ask people is, have you spoken to your doctor about that? Because it's not accusatory. It's not me diagnosing something that's completely out of my scope. It's just, wow, that sounds like something maybe you should talk to your doctor about, and puts it on the doctor, the one who should be able to identify and ideally refer out to a qualified therapist and deal with it medically as well.
Absolutely. And I think it's yet another way to sort of conceptualize it as something that is, number one, treatable. So very treatable, right? And number two, something that is independent of the person, right? So we tend to go to see a doctor because we have an injury or because we have an illness, not because we sort of see ourselves as that injury or as that illness. We see it as something that exists and that will be treated. And so I think that's a really great idea to sort of, on a number of fronts, talk about it in this way of, yeah, this is something that you might be able to discuss with your doctor, and you might be able to get more feedback about, someone you might be able to ask questions about this, and is again also taking the step of referring them to somebody who hopefully is very well equipped to answer their questions and to kind of get them help.
Yeah. Okay. So, oh, well, that was the last question I had there. Is there anything that you think we haven't covered that we should talk about? I think it's a huge subject.
It is. It really is. And I think just the fact that it's continuing to get more attention and to really be talked about in such a normalizing way, I think is so incredibly important. So, remembering both for yourself and for the people in your life, that this is something that affects a lot more people than we think, than we imagine. And that, one of the things I frequently say to people, whether they're coming to therapy for postpartum depression or for something else is that people are really used to thinking about things with a really high threshold. Like, well, I'm not losing my mind yet, so, it's still okay. Please don't let that be the threshold. Please don't, please don't wait until things feel so bad. Please don't wait until you see somebody else doing so badly, right? The time to intervene ideally is when you're sort of starting to notice, or if you have a question about whether what you have is depression or not, that's a really good time to reach out to somebody. And remember, the sooner that you're able to start talking about it, and the sooner you're able to sort of address it in some way, the sooner it will be resolved.
Thank you. So my number one piece of advice to new moms, and then I will ask Sol for, I'll ask you for yours. My number one piece for new moms, people becoming mothers, is don't lose track of yourself. Don't lose track of what makes you happy, because self-care is really important, and you might get to a point where you're so consumed with your family that you don't even know what to do if you're able to take a break. So maybe even make a list of things that you like to do, people you like to hang out with, things that bring you joy, so that if you have a moment when you really need to take a break, you have a resource, things that have made you happy. And of course, we change as we grow, and that list might change, but it's really important to know yourself and to know what makes you happy so that you can focus on that. When you take a break from your family and focus on yourself, you can come back as a stronger person, and that's really what your family deserves.
That's beautifully said. Yes, it's so true. I think that really is, the biggest thing that I talk to new mothers about is the self-care piece. And I sort of give the oxygen mask analogy. I don't know if you've heard it before, right? But we sort of talk about, when you're on an airplane and they give you all the instructions about what happens if the oxygen masks come down, and they say you should always put it on yourself first. Even if you're traveling with a small child, you should put it on yourself first, which sounds so counterintuitive, right? How could I not tend to my family, to my children first above all else? But the reason why they say that is because if you are passed out, you cannot help anybody. And that is really, really true. So if you are not okay, if you are really struggling with being able to take care of yourself, you can't take care of your family either. So in some ways, I think particularly when people are struggling with the guilt piece of how could I prioritize myself, how could I take care of myself before other people, if nothing else, I sort of say, well, think that you'll be able to take care of other people better if you are at full capacity. So the self-care piece is huge. And then also just ask for help, really, in every way, big, small. Ask people to tell you, tell you a joke, to bring over a movie, to hold your baby. Ask as much as you need to.
So I brought this beach picture for self-care and relaxation, so we can focus on those.
I'm in, yes.
There we go, a nice cocktail. That's a pretty large cocktail too. A nice drink on the beach. Maybe it has some fun in it. Maybe it's a virgin cocktail, whatever works for you. So I'm going to post a link to my previous Naptime Nutrition so that you can refer back to that for the nutritional aspect. And as always, these the topics that I cover are often topics that I've struggled with myself, and this is one of those. Other topics are issues that people close to me have gone through. If you're having some kind of struggle, please reach out, and don't ever think that everyone online is perfect, because we've all had our struggles, and they're all different, and nobody who you see online is living a perfect life, no matter what it looks like. So please reach out if you're struggling. And the postpartum depression and anxiety nutrition infographic that I'll post has emergency numbers on top. There are emergency numbers available if you need something. Sometimes you experience a symptom and you're home with the kids and you can't do anything about it. Pick up the phone and call one of those numbers. So please join me next week for Naptime Nutrition. I have something planned, but I don't remember what it is. And but I'll be here and it'll be great. So thank you for tuning in, and thank you so much, Sol, for joining us. It was great having you.
Thank you so much for having me and for talking about this issue.
Sure, and we'll also include your contact information in case someone's local. And do you do virtual sessions? I forgot.
I do. Yes, I do
Okay.
virtual sessions. I do in person, or even if just somebody needs help kind of accessing local resources wherever they are, I'm happy to help them with that.
Great. So I'll include your contact information in the comments section. And if anyone has any questions or comments or wants to relate to this, please feel free. The more comments, the more support, the more people who look at them and will feel validated in their own struggles. So please comment. How about another mom or a dad for that matter? We didn't even talk about that. But
Yeah.
thanks so much. And I will see you next week.